Hi, I'm Dave Shea, and on April 6th, which was 2 weeks ago, I tore my bicep off the bone. If you haven't seen the video yet, you can watch it on YouTube. Just look up Dave Shea bicep tear or go on my channel. And, there's a lot of videos about bicep tears, but mine's unique because you can hear it pop off the bone, not just see it roll up my shoulder. So it's a distal bicep tear, meaning I tore my bicep off my forearm and it came up. That type of bicep tear is important to fix because you'll lose your supination strength and a lot of your carrying strength. That's why insurance covers it. If you tore your bicep off your shoulder, it's just cosmetic. You'll have a lot of your strength still. Your bicep will fall a little bit, have a higher peak, but most insurances will cover that. So, as I said, I tore my arm wrestling. You can see I have a lot of championships. I've got a total of 9 different state championships from 9 different states. I love the sport. I've been doing it for years. It's something I really love to do. It's fun. I love the people in it. But unfortunately, this is a risk. When you arm wrestle, some guys like to go like sideways, like a hook. And a lot of times, if something bad happens in these kind of arm wrestlers, they end up coming this way and spiral fracture humerus. I like a back pressure style top roll where I pour the drink in my pocket basically, and I will come back. But like in the match, if you watch the match when I rip my bicep, I'm coming back, I lost the side pressure battle, I end up over here. My arm gets extended, and as I go back, I go down as well. So not only am I back, my arm's down in a semi-king's move position. You see Devin Lard, Michael Todd do this all the time. I was pulling, and I went to surge, and that's when the bicep came off the bone. I always knew the way I arm wrestled was higher risk for bicep tears, and I guess I was right. But, whenever you play any sport, there's always a risk. Now, as far as how I feel after I tore it, if you watch the video, I wasn't really upset. I just stayed calm and said, I popped my bicep off the bone. I drove to go to ER, called my doctor. They said, don't bother going to ER because they can't do anything. You need to see a surgeon. You need surgery. Dr. Wright out of Dearborn was pretty awesome. Howard Wright's his name. He hurried up and got a hold of some surgeons, and they sent me off to get surgery on my arm. First surgery he recommended had the highest rating. I looked at the size of my forearm. He didn't want to mess with it, so he referred me to Kyle Anderson, who's worked with the Lions and he's worked with Tigers. He loves the distal bicep surgeries, and that's where I went to see. Definitely MRI showed a complete tear. But when I saw Dr. Anderson, he said, first thing he told me was my tear, my tendon was farther up the arm, that was going to give more complications. I had surgery 6 days later, which was Thursday. Today is 8 days from surgery, so this is 8 days after surgery. They put a bandage on me and stuff after surgery. I was able to take it off when I got home. As far as surgery goes, when he woke up, he told me I wasn't going to be happy to hear this, but after he went up to see my bicep tendon to pull it down, not only did it come off the bone, but it's also had, they call the word frayed, which means shredded. So he had to suture up my tendon. And then if you look at my Facebook, I posted it today after the visit, he kind of drew a picture of what he did. So he had to fix the tendon before reattaching it. And then what they did, they drew a hole right through my bone all the way to the other side. They attached the tendon to a button, a titanium button. They push it through the hole, comes out the other end, and then they turn it where it lays flat against the bone. And that's how I was fixed up. He said, wants me to be extra careful because of mine, not because of the bone attaches, but because it was frayed. I'll have a higher risk of tearing it again, at least until it fully heals, which could take up to 6 months. I'm not allowed to lift anything heavier than a cell phone for 3 months. After 3 months, I'll do band therapy and maybe some light weights. And at 6 months, the average person is allowed to go back to the sport they're in, like arm wrestling if I wanted to, or football, or whatever my sport would be. So, as far as I go, I don't want to lose all the muscle in my whole entire body. So 19 hours after I had surgery, I was already down in my basement. This is my basement, and I was lifting weights. And I trained legs that morning. So now my goal is to make my legs as big as I possibly can, make my left arm as best it's ever been. So when I end up recovering, maybe I lose 2 or 3 pounds off muscle off my right arm, but not 25 pounds off my whole entire body. I don't want to have to like start over working out again, and then I'll just have to work on this, which, you know, if anybody knows me, I'll do my best. I'll have this thing back in no time. So like they recommended me icing it all the time. So if this ever happens to you, I would buy on Amazon. They have the big ice pads. They're soft. Put them in the freezer. I like them because I can wrap them around my arm. I buy 2 of them and I alternate them back and forth. Ice as many times as I can throughout the day. Probably like 6 times a day. You got to stay moving all the time because I don't want to have blood clots. But like I said, I've been active. I haven't stopped moving. They even give you these funny like little things to put on your legs at night that pump blood in your calves to stop you from having blood clots. I'll show you what it looks like. I can't bend my arm. I got to keep it in that position. Well, you can see the cut. There's one cut across my bicep tendon. Okay, here's my 2 arms right now, non-flexed. You know, I can't flex my right arm because, you know, I'm not allowed to do anything with it. But today he did tell me I can, you know, raise my hand up and down. I can go side to side, which shouldn't cause pain, which doesn't. He told me I'm allowed to try to pronate. Right about to here, I start to feel pain, and I can try to supinate. And right here, I start to feel pain. He says, "When you feel pain, don't go any further, because you don't want to injure it." This bicep was already attached, kind of higher. This bicep genetically was always lower. It looks like it's super low right now because, you know, he said this is still swollen. But he said he did attach it as low as he possibly could in the forearm. You know, as long as this tendon holds up, it should be okay. But, you know, he said he thinks it'll be lower than this one. But if the tendon starts to stretch, then it might end up looking like this one does. As far as my pain level goes, you know, I don't know. I've never been one that really cares about pain. I didn't take any painkillers. Like I said, I've worked out every day since I hurt myself. He said I can work out as long as I keep my arm in this position. So like I do my abs, I train my legs, I train my left arm. I did shoulder presses today. I did side laterals, rear delts, all that good stuff. So like I said, I'm still training as normal, but I don't go as heavy because I got to balance one arm, of course. He said as far as this goes, you know, the average person wears this for 4 weeks. He said I might have to wear it for 6 just to be extra careful with my tendon. But in the meantime, I've already started physical therapy. Physical therapy, I was 5 days after surgery. All I did was take measurements of my arm. But he says as I go there, they'll start doing different things later on as my arm heals. And then they started me off on this thing here, 75 degrees. It's only been 8 days, and today when I was there, they put it to 60. So that means my arm's straightened. And every week, he's gonna have the physical therapist lower it some more so it keeps on getting more straight until I'm hoping 4 weeks like everybody else, this thing's gone, but if necessary, maybe 6 weeks. It is what it is. I'm gonna take it easy. I'm not gonna push this arm. He did say he had a patient who was a chiropractor one time that 6 weeks after surgery, he picked up a box at work and retore it. I mean, how common is arm tears like this in arm wrestling? Bicep tears, Ron Bath, in 1998, tore his right arm, bicep off the bone, had surgery. Actually had to get repaired because he had some nerve damage in it. But he came back, his right arm's been better than ever. He's still doing an amazing job. And he's 61 years old. Unfortunately, Ron Bath tore his left bicep as well 2 years ago. I mean, he says it feels pretty good, but I haven't seen him really compete with it yet. Todd Hutchings tore his right and left arm. He swears by attaching it lower on the bone, it'll make you stronger in arm wrestling. He's better than he ever has after his bicep injury. Michael Todd just tore his, and Michael Todd's broke his arm before. But Michael Todd is having a contest tomorrow, actually. His first time competing at a high level after his bicep tear. I'm personally gonna get stem cells again. I had stem cells for my wrist to help fix me. I'm gonna get stem cells for my arm, hopefully sometime in June. I think it'll speed up recovery. I'll do that in Tijuana, Bio Advanced. Tijuana is where I go. Michael Todd got stem cells. He claims it helped him out too with his arm. So like I said, bicep tears and bone breaks are common in my sport. A lot of people have come back from them. So I mean, some people's come back stronger. So this is the progress so far. Like I said, overall, it is what it is. I'm trying to stay positive, trying to stay working out, still eating healthy, and focusing on my future. Before I even think about arm wrestling or anything like that, though, I gotta make sure nothing goes wrong and I heal it up 100%. Then we'll see what the future brings me. So this is the update. First day after seeing a doctor, 8 days after surgery. Hope this helps some people. This is what I'm going through. Have a great day.